The growth of Wisconsin's healthcare workforce is still lagging behind where it needs to be to meet current and future demand.
Our own Jake Force spoke with an expert from the Wisconsin Hospital Association and has more. Jake?
That's right, Dan and Jessica. Vacancy rates for 8 out of 18 healthcare professions across the state are in the double digits. One of the main contributions is that hospitals act as a safety net for their communities, which means that when other specialty facilities such as recovery centers and nursing homes are at capacity, that care gets backed up into hospitals and can cause backups everywhere from the emergency room to the operating room.
During the pandemic, those shortages, those delayed discharges really escalated. We thought maybe they'd calm down, but they're still there.
As Wisconsin's healthcare workforce struggles to get back to pre-pandemic levels, the Wisconsin Hospital Association, or WHA, released its annual healthcare workforce report on Monday that says there's a two-edged sword causing the issue. Senior Vice President of Workforce and Clinical Practice with WHA, Ann Zank, says that as hospitals deal with overflow of other healthcare facilities such as nursing homes, the retiring hospital workforce contributes to an even higher demand for care, an issue the WHA is calling the silver tsunami.
Hospitals have the added challenge that as their workforce shrinks, those same people that are retiring are becoming healthcare consumers.
The issue has also made work difficult for hospital staffs, who Zank says are battling to keep up with increased demand while also trying to make sure that stress isn't felt by their patients.
Longer waits in an emergency department, longer waits to see their primary care or specialty physician. You're working extra hard to make sure that that's all kind of behind the curtain.
Zank says fixing the situation will require creating more access to healthcare education in order to grow the workforce at a faster pace.
We have to make educational pathways attainable. There's so many options for what you can do in a healthcare career. That is really an advantage that healthcare has over other industries.
And the situation has become so pressing that Governor Tony Evers recently formed a task force to deal with the shortage of healthcare workers. WHA also recently launched a statewide initiative targeting younger Wisconsinites to promote interest in healthcare professions.